When it comes to screening for cardiovascular disease, there's a number of things that we can do to show our risks. Simply getting labs, getting a lipid profile or an advanced lipid profile that would give us particle size and particle number. Not always necessary, but some people like to get it. A CMP, a complete metabolic profile, a CBC, checking an A1C for diabetes along with an insulin, maybe even getting an ApoA or an ApoB, getting an Lp(a), getting a homocysteine levels. These are all options. Checking for inflammation. Why not get a high sensitive CRP or even a ferritin level? What about, besides labs, what else can we get? How about a calcium scoring test, checking for any hard calcified plaque in our coronary arteries? In addition, you could get a CT angiogram, a little more invasive. It involves dye, but it will show soft plaque. How about a stress treadmill test? Or worst case, that you need an invasive angiogram. Now, with all of these things being said, and we are checking for risk factors, what can we do? Diet is a big one. I believe in an animal-based diet, free of carbohydrates. Carbohydrates increase reactive oxygen species, cause oxidative stress. Oxidative stress leads to chronic inflammation. What about sun exposure? Increases nitric oxide. Nitric oxide needed for our arteries, for the pliability as well as vasodilatation. How about simply getting exercise? Exercise also helps our heart, helps with nitric oxide production, decreases reactive oxygen species. It's also known to be hormesis. That's giving us a little bit of negative for a lot of positive. How about the autonomic nervous system? How about keeping that in balance? If we are chronically having an elevated sympathetic nervous system and not delving into the parasympathetic nervous system, meaning we're always in fight or flight, stress mode, and never in relaxation mode of the parasympathetic nervous system. That balance can lead to heart disease, that imbalance can lead to heart disease. So stress, not enough sleep, poor diet, you can see where you can do a lot of stuff to prevent or reverse cardiovascular disease. You guys have a great day. See ya.